Aphorism 39 Organon of Medicine. Now the adherents of the ordinary school of medicine saw all this for so many centuries. They saw that nature herself cannot cure any disease by the accession of another, be it ever so strong, if the new disease be dissimilar to that already present in the body. What shall we think of them that they nevertheless went on treating chronic disease with allopathic remedies, namely with medicines and prescriptions capable of producing God knows what morbid state, almost invariably, however, one dissimilar to the disease to be cured? And even though physicians did not until now observe nature attentively, the miserable results of their treatment should have taught them that they were pursuing an inappropriate, a false path. Did they not perceive when they employed, as was their custom, an aggressive allopathic treatment in a chronic disease, that thereby they only created an artificial disease dissimilar to the original one, which, as long as it was kept up, merely held in abeyance, merely suppressed, merely suspended the original disease, which latter, however, always returned and must return as soon as the diminished strength of the patient no longer admitted of a continuance of the allopathic attacks on the life. Thus, the itch exanthema certainly disappears very soon from the skin under the employment of violent purgatives, frequently repeated, but when the patient can no longer stand the factitious, dissimilar disease of the bowels, and can take no more purgatives, then either the cutaneous eruptions break out as before, or the internal psora displays itself in some bad symptom, and the patient, in addition to his undiminished original disease, has to endure the misery of a painful ruined digestion and impaired strength to boot. So also when the ordinary physicians keep up artificial ulcerations of the skin and issues on the exterior of the body with the view of thereby eradicating a chronic disease, they can never cure them by that means, as such artificial cutaneous ulcers are quite alien and allopathic to the internal affection, but inasmuch as the irritation produced by several tissues is at least sometimes a stronger, dissimilar disease than the indwelling malady, the latter is thereby sometimes silenced and suspended for a week or two, but it is only suspended, and that for a very short time, while the patient's powers are gradually worn out. Epilepsy, suppressed for many years by means of issues, invariably recurred, and in an aggravated form when they were allowed to heal up, as Packlin and others testify. But purgatives for itch and issues for epilepsy cannot be more heterogeneous, more dissimilar deranging agents, cannot be more allopathic, more exhausting mode of treatment than are the customary prescriptions composed of unknown ingredients used in ordinary practice for the other nameless innumerable forms of disease. These likewise do nothing but debilitate and only suppress or suspend the malady for a short time without being able to cure it, and when used for a long time always add a new morbid state to the old disease.